It all began before our time, and that's how we met it. From the creative artist to the ingenious entrepreneurs, to those who have become captains of industry, to the broadcasters like ourselves, to those who trade, to those who run small and medium-scale enterprises, to the big leaders of corporations. Women have been building homes alongside their children for generations and generations. And if you do your research, whether on the African continent or any global platform in the world, women are still doing it because we're born to multitask. We run the home, we take care of our children, we ensure they are well provided for. Our husbands, we hold them strong and we stand supportive behind them all through thick and thin. That is how we met it, and that's how we've continued to do it. So today, as we continue our conversation about cholera and how it has come to find comfort in our country today, we throw it back to the women. What are you doing, right or not so right? Because when there's a gap, it means somebody has dropped the ball somewhere. We're talking about hygiene, sanitation, taking care of our meals, getting clean water in the home, ensuring that our children eat well, that our families are well fed and they're in good health. That is where we find comfort first before any other enterprise. We go to the market, you know that you're going to be doing some exchange. In spite of the fact we have the ATM where we can do transfers, use your phone or whatever, oftentimes when you're buying things in the market, you're going to be exchanging currency. When you get home, do you wash your hands? Do you ask your children, look at what I'm doing? I'm washing my hands to remove the grease and the grime. And then we learned yesterday that washing your hands with clean water, whether you're at home or in the restaurant, is not enough because there are crevices here between the fingers. That's where the soap should go and the scrubbing must begin and continue before you wrap up again with clean water. So mothers, women, sisters, grandmothers too, they are still there. This is the time for everyone to work together to ensure that Nigeria is safe, because we know we can kick out cholera in any form, shape, or size. Welcome to Weekend Deal. We had two doctors in the house yesterday, Dr. Abiodun and Dr. Machan, and they spoke expansively about what we can do to prevent, what we can do to manage and mitigate, and then the hereafter. We are now saying from where we are, let us forecast to a future where there will be no cholera, especially in Nigeria. My name is Thelma Obazo. Welcome to Weekend Deal. Patience, the glamorous patience. You're looking so glam, darling.
Thank you, and you're looking beautiful. Ooh. You're looking amazing.
Well, take over the bottom.
It is our favorite weekend show, Weekend Deal, coming to you from the network service of the NTA. We mean it with all sense of integrity when we say that we are only here because you are there. And honestly, you mean everything. You mean everything to us. Like Thelma rightly said yesterday, the conversation started. It's all about our environment, personal hygiene, taking care of yourself. I had two doctors, like Thelma mentioned yesterday, and my takeaway was this. There were so many takeaways, as a matter of fact, but one thing that resonated with me, you know how you know something, somebody says it in a particular way, and then it resonates differently. That's what happened yesterday. Dr. Abiodun said that most times when we want to eat food, we pay more emphasis after the food, and this is what he meant. Sometimes washing our hands before food is symbolic. What we do is we get the water, we dip our hands symbolically. We've washed our hands and we dig into that delicious mold of swallow and soup. After eating, we now insist on soup. It should be other way around if we have to choose, although it is important to watch before and after. But before eating, that's when, like Thelma described, the grime and the dirt, everything is on your hands, waiting to enter into you. So you wash your hands properly with soap and water, preferably on the running water. Then after you're done, you still do the same thing. Not just dip your hands in water and then wash with soap after it. Because you see, all our aspirations, all our dreams will be nothing without health. And because they're important to us, today we are focusing on how to ensure that our health is on top shape. Like I said, it is your favorite weekend show, Weekend Deal. Thank you for joining the conversation yesterday. Let's do it again today.
Weekend Deal. It's Weekend Deal, our deal, your deal. Because together we chart a course that can provide solution and can make positive impact on our country, and by association, all of us. Since yesterday, we've been talking about cholera, talking about sanitation, the role of hygiene, how all hands can be on deck to ensure that we are safe and no one goes down with cholera at any time, even now when we know it's resident in the country. And as usual, we have a background feature that will color and nourish our conversation today. Let's see it.
So there are certain persons who are at higher risk of contacting this cholera. People who live in low socio-economic backgrounds, such as those overcrowded areas where the hygienic condition of that area is not up to standard. Those people, they are at higher risk.
Most often out of laziness, they keep their environments unclean. They dispose of water, and sometimes they use toilet facilities without caring to wash both their hands or even the toilets, getting them clean. We used to have sanitary inspectors. They go from one location to another, ensuring that basic sanitation is kept. You know, there are some communities where people don't even have pit latrines. Simple thing as pit latrine, they don't know how. They go out to defecate, and that exposes anybody within that vicinity to danger.
There's food vendors where they have poor hygienic environment. They also at risk. Overcrowded areas like prisons, boarding houses, and all.
There are others who are maybe exposed because of, like they are helpless, like who has no accommodation, for instance, who has to sleep under the bridge. He has no control over what the condition under the bridge will be. So it's the municipal authority that you keep the under the bridge clean.
Water is very important when it comes to this cholera prevention and all, because the major route through which this cholera gets into the body is through injection of contaminated food and water. If this water are not made into standard and they are taken in, someone can come down with this cholera.
Water that is polluted also can be more dangerous. In fact, drinking water that is contaminated is more dangerous than not drinking at all. Because we're talking about cholera. Cholera kills in hours. And how do people die? Through dehydration. So if you don't drink water, what could happen to a human being who does not take water in 40 days? Cholera activates it within hours.
You ensure that the water you drink is boiled water. And also chlorination, because chlorine destroys the bacteria that causes cholera. And also filtration. When you filter this water, with the filtration technique, it makes the water to pass through different pores, and as they go through those different pores, it sends away dirt, germs, bacteria, and all.
What contaminant exists in one section will be different what exists in another section. You could have contamination deriving from organic matters in one area. You could have some derived from inorganic matters. Either way, their treatments are different. Even within organic, there are some that can survive under high temperature, others will not survive under high temperature. So what level of temperature will you take your water to? Then there are some also active ingredients that are in water in its natural form that your body needs. Sometimes you boil them and also destroy them. That's why sometimes you see the taste of boiled water is a bit different from the taste of fresh water from the tap, where you have good water supply system. So there's also those things. But so the best thing is, yes, if you have no choice, you boil it. What has been implicated in the case in Lagos was the tiger nut drink. It's not the tiger wood nut that has a problem. Somebody who processed it did not wash his or her hand.
For these food handling practices, those persons who are in charge of these areas where they cook, those people who are in the vendors and all, they should ensure that they observe good hygienic practices, wash their hands regularly with soap and water, because they are going to serve others. Wash their hands regularly with soap and water, and also ensure that the food, especially the meat, and properly cooked, especially seafood, because most of the time someone who has cholera, who goes to defecate and water sends them into the sea, you understand, you get the food from the sea and the water from the sea and you ingest them, you can contact cholera through that means.
Our focus on Weekend Deal today will be on sanitation, health and cholera.
Sofian, and it's also good to see Engineer Kashim Ali, a friend to the show. It is good to always see you, sir. When it comes to the fight against cholera, the place of safe water can never be overemphasized. Leading that conversation now is NTA Yanogo, and they are taking a look at having access to safe and clean water.
Bayelsa State, nestled in the heart of Nigeria's Niger Delta, is blessed with abundant water resources. Yet, this blessing comes with a unique challenge. Madam Princess Shagun explains.
Another one no dey, now we dey drink now. This now we dey cook, we drink am. Now we dey put we dey allow am now to drink. Yeah, you dey scratch us normally, you dey scratch. Now so you just dey scratch when you take am bath. So but we need help. May the government help us, may we get water. Because of the whole the water we dey use, we no dey good for the pikin body. As new baby now, now come make the pikin come dey like this. So we need help. Look at our children, then they healthy for us.
And now look at this very place. To go down there and fetch the water. Sometimes our children fell inside there. Sometimes we get some of them. There's no water here that the people can drink or that children can use to bath or take care of them or cook something. So this is the water we are making use of it.
However, we sought to no avail to get officials of the Bayelsa State Water Board to explain their position in addressing some of the water challenges. A medical expert explains how clean and safe water could be identified.
First of all, you fetch those waters. The layman will, first of all, you keep the water, allow it to sediment. That is, you allow the solid particles to settle down, settle down. Then you pour off the clean top of it and throw away the sediments that are resting under. Then you can boil this water. You can bring it to the boiling point and allow it to boil for at least 1 full minute. That is, it's boiling and you allow it to boil for at least 1 full minute before you put off the flame. You allow it cool before you use it. To disinfect your water, you have the household chlorine treatments that are available outside there. You have the water treatment. You also have the chlorine tablets out there that you can also get. And all this can treat your water, and at least you can get some safe potable water to use. Then you can also use the filtration method. You could filter your water. Initially, there was a time we were talking to people about just using your plain white cloth. Your plain white cloth, you place it on your and you filter. At least that will remove some of your sediments and all that.
Sometimes we boil the water to drink because you cannot drink this muddy water like this. It will affect your stomach. It will make you to purge. Sometimes we use the water when it's done settle, then we drink it.
Even when the water is borehole drilled, what are the parameters to ensure its safety?
Now, when water is not properly treated before it is used, there could be a lot of associated conditions with it. Waterborne diseases, to mention a few, like cholera, like typhoid, gastroenteritis, you name it.
Our organization recently provided water for community secondary school in Etegwe. The source of water is close to the sewage, and we know that the children are prone to various waterborne diseases. And our organization rose up to this challenge. And those children, over 2,000 children of that school, they're actually having safe water currently.
Cheers to a future where everyone has access to safe and clean water.
Our guests are coming into the studio at this time, so our second break beckons. Let's usher them in, and then we'll begin to get their information and their take-home on our conversation, talking about cholera, sanitation, and health.
If you're just joining us, it is Weekend Deal coming to you from the network service of the NTA. Before we went on the break, Thelma gave you a sneak peek. She said our guests are here. So the conversation proper will begin. Allow me to introduce our first guest. She is Elizabeth Ogo. She is Director of Water Quality Control and Sanitation, Federal Ministry of Water Resources and Sanitation. Let's see her profile.
You're welcome,
You're
madam.
welcome. You're welcome.
It's great to have you on Weekend Deal.
Thank you for having me here.
And we have yet another guest. She's not alone. We meet, greet, and welcome with her profile, Safia Shuaibu Isa. She is Deputy Director, Advocacy and Partnerships, Nigeria Health Watch.
Oh, no. You're welcome.
Welcome, madam.
Yeah, I'm so welcome. Okay, if you've noticed our studio today is woman power going on. Our two guests are women. I know when women are gathered, good things happen. This conversation is going to another level. So let me cut to the chase and start the conversation. So, Madam Elizabeth, water indeed is life. I mean, we have a ministry dedicated to water. Nigeria as a nation has paid a whole lot of attention to water. Why are we still where we are? I mean, we're watching from Yenagoa and we're seeing that colored, I don't want to call it water, that colored thing. And we're talking about how they will have to boil it and filter it. Why are we still there as a nation? I thank God you are in the modern ministry of water. What is our challenge with water in Nigeria?
Okay. Thank you so much for the question. In the Federal Ministry of Water Resources and Sanitation, we have the mandate to ensure the provision of safe and sufficient water to meet the needs of Nigerians, you know, culturally, socioeconomically, and also in a way that it's to guard or protect this public health, you know, of Nigerians to be able to be productive. Because when you have clean, safe water, you will be productive. Yes. Visitation to hospitals will be reduced, and you will be focused at doing your work. Yes. So what we see in the case of Yenagua is first, if you see, for the provision of water, the primary responsibility is that of the state government.
Oh, yeah. Okay.
Yes, so the state government need to take action and provide water to their people. But we see that it's something that they cannot really cover or do. And so what the federal government does is that we intervene.
Yes, I want to say
so
that. Yes.
The intervention, we have intervention programs at the federal level where we'll either, in case of cholera like this, or areas that you really see that there's scarcity of water. So the federal government comes in a way that we have programs like the rural water supply, we have the urban water supply, we have also the PWAJA's partnership for water, sanitation and hygiene. That program, you have the federal government, the state government coming together, you know, to be able to provide water for our people. And when we talk of this access, it's not just only the government. Access as the government, the private sector, the individuals also contribute to access. Because we're looking at the SDG 6.1, which talks about access to water for all by 2030. This access, as we measure it, it's not just government issue. It can be from private sector, the individuals. As of now, we are at about, going by our WASH norm report, that is the survey we do to track our access to water, safe water, as per the SDG 6. We are at 67% access.
67?
Yes.
Nationwide.
Yes, nationally.
Is that authentic and
because
accurate?
A whole lot of people don't have.
It's authentic because
how recently was that conducted?
That was in 2021, the last survey we had.
And you are sure it has not
2021.
gone down?
I want to believe it hasn't gone down. Probably if there's any increase, it will be very slight. Because when you look at the population of Nigeria, we have such large population.
Yes, true.
So usually when we conduct this survey, the difference you see, maybe the improvement is very minute because population is expanding, and then you have just the facilities and investment on the infrastructure is not comparable to the population growth. And so the increases when we see across water, sanitation, hygiene is very minimal. That's what we notice. So for the case of Bayelsa, or what we just saw, yes, it's the federal, the state government really that should provide water. And then the federal government, I said we have our own programs, we partner with them, like that PWASH. PWASH is targeting the rural area. So what happens is that the state government will say, okay, we have this amount for water infrastructure investment. And then the federal government will also put equal amount so that there's increase. That's double that will be provided for the people.
Okay.
Yes.
Okay. Thank you, Madam Elizabeth. Let me allow my friend, our sister, to join the conversation, Sefia. When we opened our show today, we talked about the role of women. And good thing, you know, Patience has been celebrating how women, when we come together, a good thing. If it hasn't already been birthed, it's already, we're birthing it right now. And these are very creative hands on deck. I talked this morning, I said, right from times of our grandmother, way before our time, women have been doing it. Our ability to multitask is not limited to what we do, or it's not inimical to what we do. Whatever we are doing, we are able to bring things together from the home where we work. You know, we have that gift. And we know that being raised, we were taught, wash your hands. My mom used to say, you can't wash your hands too many times. If it's only hand washing you are doing daily, you are doing something good. You know, have we lost that? Are we not telling it from the home anymore, from the schools where we work? Are we still washing our hands as we ought, do you think?
Wow, that's a very very profound point, because really it's a culture that should be a way of life. Hand washing is just, it should just be a part of us. And you're right, the woman is like the primary caregiver of the home, the children, the wards, even to her community. She is influential. I remember when COVID happened, and all of a sudden I remember my nieces at home coming and telling us that they must wash their hands for 20 seconds, and it was in practice. They understood why they had to do that, and they were doing it. Now I have to tell them, go and wash your hands the moment they come back in, because I have to remind, because it's like, okay, we did it for a while because there was the outbreak. Now we're not afraid anymore. COVID is over. But essentially it should be part of our daily life. Every time you go to the toilet, you come out, wash your hands. You're handling, especially when cooking, you must make sure that you're preparing your food, anything, with having washed your hands. So it's a life-saving skill, and right now more than ever it is important for our hotspots, our flashpoints where cholera, there's an outbreak. It is a message that has to go out to the community. Hand washing, proper sanitation, hygiene practices are life-saving essential skills, because we can't sit and wait for when the water supply would reach us, but we can take initiative to make sure that we have that emergency response in place, that we're practicing hand washing as a source of staying safe. And when our routine immunization, integrated outreach, health promotion officers go out to the communities, it's something that they need to emphasize when they're giving the messages for routine immunization or exclusive breastfeeding. Caregivers, make sure you wash your hands before you prepare food for your children. Teach your children, the toddlers that can take care of themselves, to also wash their hands. When your husbands come home from the farm or wherever, have you washed your hands, honey? And the older ones in our communities, also support them. Our persons with disability, support them, because these are the vulnerable groups that are likely to get infected first before the others. So it's important to just institute that culture, but at the same time, sanitation. So the cleanliness of the environment. After washing your hands, you make sure that your environment is clean. You make sure that the water you're consuming is from a safe and reliable source. We're grateful that the state governments and the federal governments are making concerted efforts to make sure that our communities are having this access, but at the same time we need to make sure that we manage it in a way that is safe for us to consume, and it is sustainable also.
Okay, I want to thank you. It's time to touch base with Katsina. Clean hands, clean life. So how do we now marry clean hands, clean life with open defecation? You see, so an anomaly there. This group of people, Nigerians, sophisticated, upwardly mobile, always thinking of gallant things to do and gallant ways to do it. How do we marry that with open defecation? NTA Katsina, please throw more light.
A case of cholera that defecates last year has a tendency to leave its remnants on the ground.
When you consume the bacteria, which is the Vibrio cholera that's causing the cholera, so by regular washing of the hands, hygiene, sanitation, it can go a long way in preventing the spread of this disease.
Open defecation as one of the major phenomena that can lead to widespread of cholera and other diseases is now minimal, as confirmed by the statistics from National Bureau of Statistics, which lists Katsina State among the open defecation-free states, with 24 local government areas out of 34 local government areas open defecation-free.
The state is prepared. You can see the number of people we have here, each one with different term of reference. Some work on surveillance activities, some work on risk communication, some work on laboratory, on community mobilization, on infection prevention and control, case management, and a host of others. So basically, we are able to coordinate any outbreak that actually maybe affect the state at any point in time, and we have all the necessary gadgets needed.
Sensitization like this from the State Primary Healthcare Development Agency, in collaboration with different healthcare stakeholders, plays a significant role in addressing the menace.
People are passing diarrhea profusely or vomiting, and maybe there is death or there is no death. The first thing to do is to report. you report to the nearest health facility. These health facilities, they have the capacity, they have the network to link the report from your household to your local government, to the state, and even to national.
Katsina having been close to Niger Republic with very close borders to the northern part of the state, the community healthcare providers are always at alert from any infections or cases of cholera and other communicable diseases.
This building of boreholes, wash facilities in about 102, I told you, facilities. Katsina has over 1,700 there about.
Although there is very little or mild cases of cholera in the state, with about 118 suspected cases with 2 confirmed deaths. These geared the State Primary Healthcare Development Agency and all other health-relevant stakeholders to put no stone unturned.
In order to control the disease is to make sure our surroundings are clean, we consume clean water, we don't leave our wells open so that they cannot be contaminated, and also regular washing of hands.
If the community fails to report, then they are hiding a criminal infection. Because I call it a criminal infection, the disease has no respect to anybody's sex or age.
We want to ensure that this infection, if it happens, it doesn't really spread, especially in the healthcare settings. Risk communication, we have already produced jingles and we are about to start airing them.
Adequate potable drinking water, consistent sensitization to the general public on hand washing before and after our meals are always on the radio and TV to abate from the menace to checkmate any threat. In Katsina, for Weekend Deal, Salim La.
I mean, for us to still be discussing open defecation in 2024 is an embarrassment to us as a nation. So something has to be done. Something has to be done. And I'm going to start the conversation from there. Madam Elizabeth.
Yes.
You see how we said during the break that this conversation is embarrassing to us as a nation. But I know you're not in that, but you're in government. Government has been talking about it. Are they providing facilities that will stop the open defecation? Are they, public restrooms? Do we have public restrooms? Do you think until we provide a facility, we'll still be having this conversation moving forward? What's your thoughts on that?
Yes, thank you. The government, I believe, is also providing as much. You know, when you talk about this open defecation and providing facilities, it's something that, if you ask me, the government cannot do alone. The private sector has to come in because there's a business opportunity in it for private sector, and so it's creating the enabling environment for private sector to be able to come in. And it's something that we also see that the private sector coming in, you have various agencies because you talk about having the land and the space. There are different agencies that will give those permissions for them to be able to really go into that business of building toilets and then operating it on like a business to be able to generate revenue. And for the government as well, it's not just the facilities, because for instance in area 1 you see that the FCT is providing these public toilets, but they are not using the toilets. Within the vicinity of the toilet, the premises, you see poo shit up and down everywhere around, because it's not just having this toilet being provided.
That's why we talked about mothers. Talked about mothers, sisters,
we need to sensitize the public. It's not just building, but using and maintaining this toilet.
But it's because it's habits that is a habit they've not imbibed.
Yes,
from the foundation.
Yes, and for some, cultural practice, we have heard in the course of our work. Some will tell you early morning they go as a group and then just go to the open. And
okay, what advantage does that bring
for them
to life and journey?
To life, there's no advantage. That's why we continue this sensitization, continuous sensitization, so that they will imbibe.
Okay, just a habit they have.
Yes, a habit, and they feel that it's a time to network, a time to receive fresh air.
In that manner.
Yes, that's what in some places,
culture.
Yes, some culture. So they keep telling you this, but we believe with continuous sensitization, when you keep talking and talking about it, they'll get to know. There are some communities too, when you involve the traditional rulers, the religious rulers, and they buy in, Definitely in such communities, we don't have problem because from the traditional ruler, it goes down.
The message has come down.
Yes.
So we now that we I mean we the media and you here on this side, we have to have a multi-pronged approach. While government is doing theirs, private sector is doing theirs, the media is working assiduously, traditional rulers, and indeed the individuals.
Yes.
You know, they need to be sensitized, right, about how they can change, because this is the first time hearing of such a thing. I don't know if people have heard it before. That's a way to socialize.
Yes. That's what they do in the communities.
Each man to his own, really.
These are the insights that you glean when you actually roll out such sensitization campaigns. And it's very important that you approach from this angle, because that is when you'll be able to address this cultural or social barrier, because you don't there's no vacuum. You can't program in a vacuum. There's something that is existing. You want it to change. You have to go with a superior argument, an alternative that they can buy into. So, okay, networking is good, but can we network in a safe and hygienic manner? Because when we do this in the open, there is the tendency that we are rendering our community to an outbreak, a public health crisis, and we don't want to lose time taking care of or spending money accessing care. Can we practice better hygiene for when we have
bonding time? Can we practice better bonding time?
Can we save it for when we go to the market?
Local meetings,
Can we even do this privately first and bond after? Because that early morning gist, the brain is activated. They want to share ideas so they can move forward progressively. Can they please do this first and then meet together to plan? And that's where we must involve them. We must get people who have that belief to be part of the plan.
You have to understand the culture. You have to understand what drives them. You have to understand what influences them in order to give them that.
We have some messages here.
Okay, go ahead, man.
No, that's as part of the sensitization too. The federal government has the Clean Nigeria Use the Toilet campaign.
Oh, okay.
So that is what also helps us. We are hoping that by 2025, Nigeria will become open defecation free.
Amen.
That is what we are hoping, and we are working towards it.
That's next year. We're looking at next year.
But we must go into the hinterlands.
Yes.
Say use the toilet. Telling someone use the toilet, it's like what she just said, it may not have much impact. What they will say, those who want to shoot. We have our method here and it's working for us. So that campaign needs to, we need to become more intentional. And we need to name it as it is. And get those key players who have this way of harnessing and synergizing, like she said, to buy in. That thing for them is English. How often do they watch your promos? No. Some of them do not come near television or radio often.
You have people who go to the village.
People will go down. You collaborate with the states and the LGA communities to be able to do this.
Reach out to them.
What you call the wash departments in the local governments.
How many states has the wash department covered?
States. Yes. Each state has a wash department, either department or unit. They work as either a unit or a department.
Okay.
Yes. And
we need to keep checks and balances.
The message
we need to
down.
We need to keep checking.
Yes, of course.
We need to keep checking. If you say next year, and by 2024, we are still doing packages where there's blatant open defecation. Someone will see a toilet and walk by it. It means that we need to do more. And we need to look for more innovative and ingenious ways to marry them into this conversation, because like she said, it's in their best interest to leave this unique cultural practice aside for now and let them buy into. It's not because we want to remove them from what they are used to, it's because we care about their health and their longevity and their well-being. They like what we're discussing. Nigerians are saying well done. It's timely. We have a message from Yobe. Uma says, well done. I like the conversation. We have a message from Bayelsa too. They say, well done. Thank you. Okay, so let me just take some another direction. Someone says, your program is very educative. I want to observe and let you know that a tribe in Nasarawa Local Government Council, they don't create toilets in their homes, but they align with what you are discussing. They do it in the open. He's asking, it says, what is the work of the appointed health workers? And sometimes people go to toilets and there's no water. And they say, if there's no water, what's the essence of doing it in there? Let me marry it with another observation. Sanusi from Owode local government area says, well done people, well done Nigerian women. We like the way you are sensitizing us. Please do more. But earlier you opened up with the handling of money. You talked about the market. Now please throw more light on it so that many will understand that it's not even the look of the money. It need not be tattered to have gems on it. No. Once it's been handled by somebody else, so most likely there are gems on it. Please expatiate further. So let's marry those two. Let's start with you, Sophia.
Yeah, so you know, concerning, you know, we're talking about utilization. So you've provided a public health toilet and it's not being used. It's important for us to understand why. And that is why, you know, that whole community buy-in from the start is important. Perhaps it's not situated in a place that is convenient for them, or perhaps, you know, it's the access to water that is the challenge, like you've you know mentioned. And so what can we now do? I think it still boils down to the community. With the buy-in of the community leader, we can advocate the next line of authority, which is perhaps the councillor or the local government chairman, to make sure that these public facilities are connected to the water supply that can be used in a hygienic manner. But it doesn't stop the community leader from sensitizing his people to keep using the public toilets as opposed to open defecation. It is not acceptable. Open defecation does not have any benefit in any way.
Excuse for it.
Like,
It's unthinkable.
With what we can see happening in the environment, the flooding, it's a clear indication of the devastation that this is bringing. This is the number one cause of this outbreak that we're experiencing. So imagine a whole field, you know, of feces, and it's washing into the water sources that the community is consuming. So,
all right.
I mean, it's a clear messaging that a community leader, a woman group leader, anybody in a position of authority or influence can capitalize on to get behavior change.
We need to even go to the homes. Yes. We said earlier, look to the homes. Because when you convince that woman, and oftentimes I learned something as well, that people will ask you, what is the need for me? Your health, your longevity, your children staying alive.
I mean,
oh my God.
Is there any more need than that for survival? Because whatever economic pursuit you are, you know, thinking of,
you need to
it
be
is
health.
when you are healthy
that you can achieve it.
Of the cost you're going to spend. And then apart from the spending, there is time. When you're not well, you cannot do that business.
It's as simple as that.
It's just weighing the value that these practices bring as opposed to, you know, letting it down.
Okay, so I mean, whether we like it or not, our health is our wealth, and it's our transport to the future. If your health is in jeopardy, the future becomes very bleak. Anyway, right now, like we've said over and over again, there's an outbreak in Nigeria. There's cholera in Nigeria. Over 2,000 cases have been reported. About over 50 deaths already also recorded. This is so sad. NTA Calabar were telling us, and cholera is not just only in Nigeria. It's a global struggle. So many other countries are going through the same struggle. NTA Calabar were telling us the global impact of cholera. Let's watch this.
Cholera is an infectious disease arising from poor sanitation and hygiene. It is transmitted by ingestion of contaminated water or food. This disease occurs where water supply, sanitation, food safety, and hygiene are inadequate.
Cholera has been eliminated from Europe and North America. It continues to be a significant problem in Africa and Southeast Asia. According to the World Health Organization database, Cholera affects about 1.3 to 4 million people globally and causes about 21 to 143 deaths annually.
We are yet to confirm a positive case. The last outbreak we had in the state was in January 2024, where 3 cases were confirmed. We did our best to curtail them. We lost 1 out of the 3, but the infection was stopped, the transmission was stopped. So between that time and now, we've not had a positive case being confirmed.
In Cross River State, what is the level of awareness?
In Cross River, we have reactivated immediately our Public Emergency Operations Center, which coordinates activities of the infection and the transmission across the state. Our local government areas have been activated. Our response teams are on ground. The communities are involved. In every community, we have notifiers. People are conscious of the symptoms of cholera, vomiting, passing watery stools. So once these are in play, once these have been identified, they are reported to the nearest health facility, and then the office in the state is confirmed.
We have the World Health Organization who provide guidance and leadership in the prevention and control of cholera. We have UNICEF vaccination programs who are involved in provision of vaccination. We also have the International Committee of Red Cross who provide humanitarian services in cholera outbreaks. We have the World Bank who are involved in water and environmental sanitation.
And what are the preventive measures in order not to fall victims of this acute diarrheal disease?
Once you suspect that you have cholera, or you know someone you think has cholera, the person should be taken to the medical facility as soon as possible. And even while you're trying to get the patient to the hospital, oral rehydration therapy should be given to the person.
It is safe to say if one ensures personal hygiene and keeps the environment clean. Washes hands with soap and clean water frequently after using the toilet. Drinks only safe water, including boiled or disinfected water. Eats food that is completely cooked and hot. Washes fruits and vegetables before eating, and preferably eat only those you can peel yourself. We can prevent and curtail the incidence of cholera outbreaks and other sanitation-related diseases.
We're talking, women now, we're talking behind the scene because everybody's bringing energy to this gist. We're still awed by some of the information that is being unveiled here, especially with regard to open defecation. People will see a toilet and choose not to use it because in our opinion, having a toilet, whether there's water or not, still beats going out to the public and opening up and doing the most private business any human being can do, doing it out there in the open, knowing that a child could walk by, in spite of the fact we say cultures promote togetherness early in the morning. Did they also promote young children seeing an adult not dressed? And imagine a child of 5, which is going to school or going to buy, or a child of 10, let me say, going to run an early morning errand, and she passes and sees adults having community discourse. They're not fully clothed. That's a nightmare she will have for a long time in her life. It's not everywhere.
And so that's why you can never have too much sensitization on this, matter.
You've said it.
You cannot have. So, just because you and I and some other persons are aware and we see the wrong and the whole unpalatable nature of this, some don't. Obviously. That's why this is still happening. And so you have to keep talking. You have to keep engaging. You have to keep promoting the message and making it as crude as possible in their own
speaking their local languages.
Thank you.
Find what sometimes you need to dangle the carrot and stick. Give them something else that they want to encourage them to key
Most
into
importantly, let them see the benefit that is in store.
in the most ingenious way you can, because speaking it in English obviously is not enough.
It's not enough. So we meet them at their point of understanding. The local languages in formats that are most resounding. Is it audio? Is it visual? For you to see the environmental impact. And I just want to mention that in this era of urbanization, so yes, we have culture, but we have people migrating from all over.
Yes.
Coming into city centers.
Indeed.
And that is where we have urban slums coming up, and then they build their own culture. So it's not even like an ancestral thing that needs to be protected based on values. No, it's just because the situation now, this is what we have to manage. It's not ideal, so we'll just introduce this. So it's not even something that has a basis that you need to contend with.
Yes.
You just need to make them understand that it is not sustainable. We cannot continue like this because you're putting the whole population at risk.
In danger.
You have to take responsibility. So while government is playing their own part, individuals, communities have a part to play. Use the public facilities. Ensure that you're getting your water from a safe source. When government provides a borehole or a well, protect it.
Own it. Protect it.
Ownership of it. So that it serves you longer and keeps you in good condition to function better. Our health facilities need to have access to clean water in order for them to respond in emergency cases like this. You can imagine having a primary health care center that has to respond to cholera and is not connected to a clean source of water. Just imagine the crisis or that kind of scenario. So the treatment protocol, our frontline workers need to be equipped in order to respond in this manner. It's a coordinated.
It's a coordinated thing. It's something I just want to resound the fact that we should stop saying government property. We should say it's our property. We should own it. I mean, that borehole belongs to you.
Government put it there for us.
Because they give it to us. Yes, but the fact that people now say, what we call it government property, whatever towards it is different. That is why when there's an issue.
I'm agreeing with you that government built it for
us. It's our own.
Because government is not in there.
And usually,
it's us.
Usually, when government provides, we have what we call the WASHCOM, that is Water Sanitation and Hygiene Committee within the community. So we don't just provide and leave.
Okay.
You provide, you train them on how to maintain the borehole, to keep it clean so that it can be sustained. And if there are issues that is beyond them, they go maybe to the local government or within the states. There are those that can provide the spare parts they will need to keep.
When you go to communities like this, like the nooks and crannies of Nigeria, do you call the women aside to talk to them?
Yes.
Different age grades?
Yes, for instance, when we do this, we have what we call the community-led total sanitation. So you trigger the community using this approach. You are triggering them to know that it's good to have a toilet, to know that when they don't have the toilet and they poo-poo outside, when the rains comes as we have it now, it washes whatever into their rivers, and it means they are also drinking their poo-poo. And so when they have that understanding,
which was not on the agenda,
they have that eagerness. You see it in the community. It's like, oh, is that what has been happening? Is that what we have been doing? And so there's that eagerness, they start constructing toilets. And those that, there are some communities you see that they don't have the resources really to dig the toilet. So they have what they call the adashe, this esusu they do. And so contributing, maybe is this person's turn, they will now go dig the toilet. We have seen that. They go dig the toilet for
efforts.
Yes.
So see communal effort
yes,
now.
they'll be able to, from one household to the other, just to make sure that everybody in that community now, and that is when you, like I said, you get the buy-in of the traditional leader in that place. Everyone, you know that if they even make laws or sanction whoever they see. And for those that one we talk about the children, when they go out like this, they have where they call the open defecation area, which means that the children will not pass there. Yes, there's the area that is designated. They know within the community, oh, it's time for us to go. They will all come, meet, and go to that location to go and have their thing done.
early morning.
I see an
That's
opportunity
what they do.
for engagement.
So, but when you continue this triggering, you see within you talk to the women, you talk to the children, you talk to the men, you know, you see within them, those we say the natural leaders, they get gingered,
excited.
Yes, they don't want this in their community.
They want to bring change.
And then they don't want this in their community, they want to change. And then they start working towards it, making sure even within that period we have those we call the voluntary hygiene promoters, who also now be going inspecting homes to be sure that they have toilets.
Oh, that's good.
Okay, so there are issues like that. It's well that done. the work is enormous.
It's enormous.
Yes.
And
continuous.
Yes,
and
continuous. It's a whole lot is going on, because you said the word is enormous. You're doing so much yet, the impact is not much yet, even though so much work is being done. But I am interested because for so many times we've had discussions around water. Today we are facing an outbreak of cholera, and the major cause is because we don't have safe drinking water. That's number one cause of the cholera we're facing today. And most times when we have this discussion around water, they say the governors providing water for the state resides within the powers of the state governors. As a federal ministry, I know you are intervening, but is there any, because we haven't this excuse of governors have lasted for too long, and the states are going without water. What can be done? I mean, something beyond just an intervention, so that the state governors can be actually brought on board to understand that maybe one of the things you should do beyond anything else is to ensure that your state, your citizens are drinking clean water. I don't know. It's worrisome because, like I told you, we have conversations here over and over again about water. And they will tell you, it's okay, that resides with the governors. And the states are not having water. I know my states, we are still struggling. What can be done? What are the challenges? I know you might not know. I don't know. I don't know what to say anymore. Water is key.
The much the federal government can do is just to intervene. Where we see that it's really scarce, where we see that there are waterborne diseases, we go in there. Even in we now have the MOU we've signed with the Federal Ministry of Education, even Federal Ministry of Health, because the indices as well in these places or in these entities are so bad. They are so bad. The access is still low. So we believe that when we partner, and then when we are able to get support from individuals, from the donors, we'll be able to target this support to these areas. Looking at federal institutions, talking of the tertiary institutions, secondary institutions where they don't have water, or what they have is not adequate, we're able to come in, because it's government resources we know is dwindling, it's reducing, it's not sufficient really to say we will be able to use that to reach out to everyone. So we also have partners who come in. We have foundations that are willing, who are into water, sanitation and hygiene. So when they have programs, the ministry is aware, we will not put those, call in those areas where there are challenges with water, and direct them there. From what we have, those requests, we'll be able to address those issues. But like I said, it's not something that can go around, or it will be something that will be done at once, because resources are limited. But if the governors who have the primary, is having the understanding that if you provide water, it is preventive health.
Yes.
If they are able to know that and focus on providing water, the resources you will use in curing people,
I'm telling you,
in hospitals will be reduced. Will be reduced. But it's having that understanding that water is key, sanitation is key, hygiene is key. And that will
very
help
interesting discourse.
Go a long way.
The efforts to provide infrastructural development for Nigerians must be ongoing, must be relentless, must be dogged, and Nigerians do need to key in. You mentioned something about the private sector, and private sector does not finish. Private sector is even you and I in our homes. Private sector is community. It's not just big organizations and corporations, and Nigerians also need to understand that. that when they are not at work, even for government, they are now the private sector.
Yes.
And they must do what they can, do the needful to continue to grow the efforts that have already been put on ground. Because if we utilize what is on ground, we can even do more. Like President was saying earlier, is government too. Not their own, it's for them. Let everybody be concerned. We have many messages, but we'll take a break now. When we come back, more from our studio guests to enhance our conversation. And thank you for all your messages. We'll address as many as we can. Our break is now.
If you just joined us, it is Weekend Deal, your favorite weekend show on TV. I'll be taking a look at sanitation, personal hygiene, the cholera outbreak, and more. And we have two power women in the studio, and we've been digging into the conversation. We'll continue where we stopped. So, I mean, honestly, I saw a video of a woman in a place. She went to buy vegetables. She cared about her family, so she went to buy vegetables. And what my skin started, I don't know, I can't even, talking about it, I'm feeling one kind. She goes home to wash the vegetable, and the water she used to what she was going to cook for her kids. Here she was, careful. Sophie, I know you people do advocate saying, what do you tell women like that? Okay, now I care about my children. I want to prepare a vegetable dish for them. I come home, the water is even, I don't know what to call that water, liquid. So for women like that, what should they do?
I was talking to Madam Elizabeth, and I was saying that there has to be the barest minimum provision of facility by the government, talking about having the private sector foundations partnering to provide water is good, but the framework, the system has to be coordinated by the federal government such that there is equity. It is available in all these nooks and crannies, particularly for the vulnerable population. Now, this woman probably doesn't have any other source. That is what is available to her. On the part of sensitization and health promotion, we would tell her that, you can collect perhaps rainwater. It's a reliable, safe source. You can perhaps collect water, boil it, filter it, and when it's cooled down, you can use it in the home. Exactly. We can say, go to a protected well, a well that is, built up from the elements, covered, and that is a reliable source. But, the addition we can add also is use salt to clean your vegetables.
I like that.
To destroy
why about even boiling that water? Can the water not be boiled?
I know, she just said yes.
So, I mean, it is I think it's the first method of actually consuming safe water that I got to know about. Boiling, filtering, before, the advent of water treatments by other companies that are available. But I'm still speaking about situations where there is only that open stream as a source of water, and what government needs to do in situations like that. There has to be that basic intervention, and so we will continue to advocate and ask that this basic minimum availability of water needs to be in place, while we sensitize our women and communities to also include the use of water treatment, boiling before consumption, before preparing food, washing their hands, making sure the environment is clean, just that other, it has to go in tandem. It can't exist outside each other. So it's a coordinated, multi-pronged response. Education, sensitization never stops. Government needs to play their part. Make water available. Make public facilities available also. And I just want to mention that water has no substitute. So it's important that we use it in a sustainable manner. With the advent of climate change, population explosion. There's some it's not even a theory anymore. We see the reality. The number one source of conflict or reason for conflict right now is access to water. People want to protect that resource and own it, like the Lake Chad Basin. I'm sure you've seen news. It's one of the number one triggers for water. So it has no substitute. We have to learn to use water in a sustainable manner. So educating our communities as well.
Do you remember growing up, we had this thing at home, it was part of, almost every home had it, filter. We put water in it.
Water filter.
Water filter. Yeah. I remember my mother, have you worn a filter? It was another, that's one work I didn't like. Apart from washing water. Sis, I didn't like that work. So we are looking at, when I said, they filter, everybody is disappearing. Then my name will be called Eloy. And I'm like, okay, here we go. So we used to have those.
As far back as that, you know, I said back to the mothers. Back to the mothers.
Yes.
See, she already imbibed that culture. That water must be clean, and this is one way to preserve it.
Yes.
Some people have done it through boiling.
Yes.
Some have done it through sieving. But see, from time memorial,
we don't have those things again. I was even thinking we don't have those gadgets at home anymore. In those days, you go to every home, it's standing. I don't know. It's so
everybody's
cool.
buying is the dispenser now.
And
bottled water, so that is gone.
Oh,
I wish we had something like that for rural areas where they can actually use.
This is even an innovative idea for anyone who has enterprise.
Yes, make it more modern.
To start making more of that, so that everyone can have a choice and they can filter their water. Can I take a few messages?
Yes, please.
Because I think some of our viewers, maybe you missed the other part of the program. You're saying we have not talked about what's been done in the rural areas. Julius Ayodeji
extensively
from Abeokuta, Madam Elizabeth and our sister here, they spoke expansively about the role of traditional rulers.
Yes.
He even talked about the rulers, community development, information. We did that, right?
Yes. Extensively, as a matter of fact.
But you want to just recap?
Yes.
You want to just recap?
What I said then was that, you see, to prevent open defecation, for it to be effective in a community, when you get the buy-in of the traditional leader or the religious leader in a community, it makes the work easier for you. Because since they have the buy-in, they will now have like rules, bylaws in those communities, and they sanction anyone they see defecating in the open. They have people who will be watching out.
Yeah.
So once they see anyone defecating, because the traditional leader is interested, then you see that they sanction such people. And when you know that that is existing in that community, you see everybody wants to have a toilet in their home. No one will want to go defecating in the open when you know that you'll be sanctioned. And the sanction at times can be something of, a name and shame. And you will not want that for yourself.
Some fines.
And sometimes fines. So you will not want that. So that happens. And then also in the rural community, there's what we call the community water safety plan, which they are taught, trained, from the point of use. That is the point of source to the point of use. You guide the communities how they need to handle this water. Because at times, those who have the borehole functional, the borehole could be safe, but by the time it gets home, the water is contaminated. Because of the way they handle the water. Probably he has gone to poo-poo while fetching water, you don't wash your hands.
Or handle some dirty naira notes.
Exactly, dirty naira notes, there are germs there. You now just carry your water, maybe you won't do like this. Some will use leaves and say they want to cover the water so that it doesn't, but you don't know you are introducing contamination into the water.
Oh my goodness.
And so these are ways we try to educate those in the communities to keep their water safe. And the container they use, they need to wash. That's talking about the hygiene, the sanitation of the source of water. Because if the whole place is filtered, filthy, that's also a problem for those who are using water from that source.
Okay.
So we do sensitize them on this.
Well done, and like we said, we hope more people jump on this band because it's a whole lot of work so that they can make impact. As few as they are, they're working so hard, but like she also said, it's like a drop in the ocean. We need more hands on deck. We need the governors to buy in. Where you provide water, your people will not get sick, you will not spend money on health facilities. I mean, What a great joy. So our wonderful governors, you're doing well, buy in.
Someone is telling us here that Bayelsa State has appointed over 30 commissioners already, and there's no commissioner for water resources. And he's saying that perhaps that's why there's now a confirmed case of cholera in southern Ijaw local government area. We did check, and we saw there was a commissioner for water resources last year. So we don't know, how true this is, but were this to be the case, we know that the Bayelsa government is taking note.
Yeah.
Okay, and we thank you for your message. He sent another message again, and let us know who you are. Again, this is the third one.
What
I
did
was
you say now?
talking.
What did you say?
He said there is no commissioner for water resources.
Why?
Bayelsa. Please let's know who you are. Okay.
Yeah.
As someone says, thank you, Weekend. Simon Adamu from Lagos. I like the way you have spoken so candidly, so honestly, in an open manner. And if Nigerians really are listening as they should, there should be a difference based on what you have discussed today. He says, but I want to talk about some areas in Lagos, like the Abuja bus stop and Marina. It says perhaps government can do a bit more about providing necessary amenities, like public toilets, and then also come around to do this sensitization so that people can listen and know the reason why these things are put in place for them. Simon Adamu from Lagos. Do I have time to take one more?
Yeah, please do one more. Fine.
Okay. Someone says, good work. The ladies in the studio, kudos.
Thank you.
He said, however, the talk should not stop here.
Oh, okay.
We should take it out there to all Nigerians. Every strata, everywhere they are, they must not only listen, they must understand. NTA, please don't stop here.
Thank you.
Okay, I think we have to rest it here. Many more.
Many more.
So let me just support the last message and say that it is, the work of sensitization never stops, like I was saying, and you are playing your role.
Thank you.
With this education that you are doing and informing the public as a health organization and advocacy organization. We understand the place of really informing the public with adequate tools for them to make informed decision. Health-seeking behavior benefits you first before the wider community. So if you understand it from that prism, that it's just you taking responsibility for your own health, for your own safety, and then you now replicate, it has a wider impact and reach. And so while we keep advocating to government to provide the necessary amenities, our work of sensitization through the media, through fellow advocates, through all the agencies and institutions that are charged with informing and education, we must maintain the tempo. There's, Madam Elizabeth mentioned ending open defecation 2025. There's a roadmap for eliminating cholera by 2030. So it's a joint task force with very key ministries involved, and then there is the whole community engagement. There's the whole administration of the oral cholera vaccine. Your guests yesterday talked extensively about it. So it's a coordinated response from disease detection, early warning signs, being prepared for those flash points. I did.
You watched yesterday.
I did, because it was important for me to be ready for this conversation. At the same time, I learned a lot too.
Okay, Madam Elizabeth, maybe you want to say a few words as we close?
Just in addition to what she said, it's important when we talk about sanitation. You see, sanitation is a personal thing. So it's not about leaving it all to government or leaving it to the private sector. The individual really needs to take action, because sanitation is personal, hygiene is personal. You talk about the water supply, yes, you say probably that is where the government should come in. And we usually say sanitation is dignity. The going in the open to defecate, in fact, for a woman or for anyone at all, there's no dignity in that. So it's not a practice we should continue. We need to stop it. And the sensitization, of course, will continue to go on, because those who have such cultural practice, the message, by the time they hear it over and over, I believe one day they will get the message and know the importance of not defecating in the open but using the toilet. And the campaign, we said, clean Nigeria, use the toilet, so that we have a healthier environment and a productive force.
You know, yesterday, patients, I was saying, we mentioned today that Dr. Abiodun said cholera treatment. Federal government is saying it should be free in all government hospitals. We can also enjoin the private hospitals
Just
and
to
clinics
join in.
to also make it free.
Yes.
Okay?
So the
one for all for one. And Nigerians,
And
anything you hear that will better Nigeria, please take it.
Yes.
Take it and spread it.
Spread it.
If
And
Nigeria wins, we all win.
we all win. And the truth is, your hands can literally kill you or save your life.
Exactly.
Your hands, they belong to you. It can save you or kill you. Please keep your hands clean.
And the
Clean
cheapest-
hands, clean life.
The cheapest vaccine is hand washing.
Hand washing.
Okay.
You have spent some time in the office, wash your hands.
Yeah.
Wash your hands all the time. If not, I will not shake you again.
Okay, we say God bless Nigeria here.
Goodbye. Bye. We love you.